Hi, my name is Dr. Sushil Basra. I'm one of the spine surgeons here at Long Island Spine Specialists. Our patient Robert is a patient of mine who I've actually gotten to know over the last 5 to 6 years. He initially came to us for a second opinion. He came with a pretty significant spinal problem and deformity. Prior to seeing us, he had had a number of spinal surgeries.
I couldn't really walk anymore. I couldn't stand up straight, and I was headed for a wheelchair. No other doctor would touch me because I had prior surgery from someone else. An OR nurse recommended Dr. Basra to me.
We were able to get the appropriate x-rays, appropriate images, and a thorough history and examination. We determined that he had a significant spinal problem. He had a deformity, which we call a kyphosis, which meant his spine was leaning forward. And he also had a curvature, a scoliosis, which meant his spine was really tilted to the side. He was having extreme difficulty with keeping upright as his spine would keep pushing his body forward. And this led to exhaustion, back pain, and really limited how much he could walk.
Dr. Basra turned around and said, we could do the surgery from start to finish. I said, okay, explained everything to me. That it would be 2 surgeries, how long it would take, and he performed it.
So on the left here we have a picture of his spine, an x-ray of his spine prior to surgery, prior to our revision surgery. So here we can see the previous hardware or screws and rods that he had in place. But more importantly, if we follow the spine up, we can see how it's really tilting forward, that kyphosis, to the point where his head, or the upper part of his body, is about 20 centimeters ahead of the middle part of his body. This is what was giving him that discomfort, the pain, the inability to walk. His original surgery was in the lowest part of the spine where there was a fusion. Initially, we would remove the hardware from L5-S1. Once that was completed, we would place new hardware up to the middle or upper thoracic spine. We also placed screws into the pelvis. This allowed us to perform a large instrumented fusion type of surgery and ultimately correct the spine to remove the deformity. What we were able to accomplish was placing all of the pedicle screws, these screws right here, and then bringing the spine back to a neutral, more balanced position.
It was a tough surgery. I mean, not many doctors or no doctor would actually do that type of a surgery and do the complete surgery. That was the biggest problem. The doctors that I were going to, they're supposed to be the best in the field, were telling me, no one can do that surgery. It's too extensive. Plus you're too old. You wouldn't live through it. And Dr. Basra, he had the confidence, the knowledge, and the skill to be able to do it. And I'm alive and well today.
There are many patients like Robert out there who may have a huge problem or may feel a spinal surgery is too dangerous. And I think in this particular case, we proved to a lot of people that no matter how large or big the problem may seem, there are potential options, potential solutions so that your quality of life can be better.